name is Tony. Today we're going to be talking about burns and smoke inhalation. Burns and smoke inhalation is a part of the soft tissue injuries. Burns accounts for approximately 3,400 deaths per year, among the most serious and painful of all injuries. A burn occurs when the body receives more radiant energy than it can absorb. Source of this energy may include heat, toxic, chemical, or electricity. You gotta always perform a complete assessment to determine whether the other serious injuries are present. So you're always looking for whatever is hidden. You got the obvious in front of you, and you gotta look beyond the obvious. Children, older patients, which is the geriatrics, and patients with chronic illnesses are more likely to experience shock from burn injuries. Burns are soft tissue injuries again that are created by the transfer of radiation, thermal, or electrical energy. Thermal burns occur when the skin is exposed to temperature higher than 111. Again, the skin has to be exposed to temperature higher than 111. Now, the severity of the thermal injury, it always directly related with temperature, concentration, amount of heat energy possessed by the object or substance, and the duration of the exposures. I mean, the temperature is very important. What's the concentration is what area, and how it's coming down at your body. Amount of the heat, how much heat, okay, and how long. The greater the heat energy, the deeper the wound. People reflex limit heat energy and exposure time. They cannot do so if unconscious or trapped. When a person is burned, the skin that acts as a barrier is destroyed. Burns create a high risk for the infection, the hypothermia, the hypovolemia, and the shock. Burns to the airway are significant importance. Circumferential burns of the chest can compromise breathing. Circumferential burns of an extremity can lead to a neurovascular compromise and irreversible damage. The burn severity depends on depth of burn, extent of burn, critical areas involved, face, upper airway, hand, feet, genitalia. Pre-existing medical condition or other injuries, patient younger than 5 or older than 55. Also the depth of the burn. Superficial first degree burns involve only the top layer of the skin. We call them, these are superficial because they're all on top. Then you got the partial thickness, which is the second degree burn. Okay, it does involve the epidermis and some portion of the dermis. That means the top and a little bit on the bottom. Blister are present. Full thickness, third degree burn, extend through all skin layers. So we go first degree, second degree, and the third degree. This is depending on what layer they are going to. Is it going to the surface? Is it going beyond the surface or all the way in? The extent of burn. Estimate using the rule of palm or rule of 9. This is how we know how much is the burn. We could use the rule of 9, which we all know, which the body will be divided into 18 parts, and then we rule it as the rule of 99. The portion differs for infants, children, and adults, include only partial thickness and full thickness in estimating of the extent of a burn injury. Okay. So as you notice, every part of the body is given a number, and this is the rule of 9. You got the head 9, you got the back, you got 9 and 9, which is 18. You got the front torso is 18, the hand is 9, the left hand is 9. Then you got also 8 and 8 with the genitals is 1. 39. Now, when you assess a burned patient, it is important to classify the victim burn. Classification of burn is based on the source of the burn, depth of burn, and the severity of the burn. Now, the scene size up, you come up, you're gonna say, make sure, first of all, scene safety. We always talk about scene safety. Observe the scene for hazardous and safety threats. Ensure that the factors that led to the patient burn injury do not pose a hazard. That means it's gone. If there is a fire and he was burned in the fire, you do not go in the fire. You wait outside. Mechanism of injury, determine the type of burn that has been sustained and the MOI. The MOI, in order to get the MOI, you got to gather information from the patient about the extent of the injury. You got to assess the scene for environmental hazard. Determine the number of patients that you have. Call for additional resources right away. Okay, consider the potential for other injuries. Begin with a rapid exam. Form a general impression. Look for clues to determine the severity of injuries and the need for rapid treatment. You gotta be suspicious of clues that may indicate abuse. Okay, what can, you gotta look, cigarette burns, cigarette marks, stuff like that. Consider the need for manual spinal stabilization. Check for responsiveness using APOS. The primary assessment also will make you do the airway and breathing. That's very important. Ensure that the patient has a clear impact in airway. This is always your ABC. Be alert to sign that the patient has inhaled hot gases or vapors. You want to make sure this, because hot gases or vapors also will make sure that will cause burns into your airway system. Sign facial hairs. Okay, so the suck present in any around the area. Okay, airway and breathing is still okay. You got to do heavy amounts of secretion and frequent coughing may indicate a respiratory burn. Quickly assess for adequate breathing. Inspect and palpate the chest wall, decap, BTLS. Circulation, assess the pulse rate and quality. Determine perfusion based on the patient's skin condition, color, temperature, and capillary refill. Control significant bleeding access. Assess for shock. Transport decision, consider rapid transportation and airway or breathing problems, significant burn injuries, significant external bleeding, signs and symptoms of external bleeding. All these, you gotta make sure that you gotta go fast. Okay, consider consult. Okay. Now, invest the chief complaint. Be alert for signs and symptoms of other injuries due to your MOI. Typical signs of burn, pain, redness, swelling, blister, shining. Investigate the chief complaint. Regardless of the type of the burn, stop the burn process, apply the dressing to prevent contamination, treat the. Then you take your sample history. Along with the sample history, ask for the following question. Are you having any difficulty breathing? Are you having any difficulty swallowing? Are you having any pain? Check whether the patient has any emergency medical identification. Now you're going to go down to your secondary assessment. Okay, you're going to do a physical examination again, perform an exam of the time body, assess the patient from head to toe looking for decap BTLS, make rough estimate using the rule of nines of extent of the burn area, determine the classification of the burn, determine the severity of the burn, package the patient to transport. Now, you're going to also assess the respiratory system involved looking, listening, and feeling, assess the patient neurological system, assess the musculoskeletal system, determine any early set of vital sign with help you to know how the patient is tolerating his or her injury. Repeat the primary assessment and reassess the patient vital sign. Reassess the chief complaint, reevaluate intervention, stop the burning process, assess the treat, breathing support, and circulation. Provide rapid transport. Oxygen is mandatory for inhalation burns and large body surface area burns. You have to give oxygen O2. Healthy green. If the patient has signs of hypoperfusion, Treat aggressively for shock and provide rapid transports. Now, your communication and documentation. Provide hospital personnel with a description of how the burn occurred. Describe the extent of the burn, amount of body surface area involved, depth of the burn, location of the burn. Document if special area are involved. Stop the burning process. Prevent additional injury. Now, let's talk about thermal burn. Thermal burns caused by heat. Most commonly, they are caused by scalds or open flame. A flame burn is very often a deep burn. Hot liquid produces scald injury. Coming in contact with object produces. A steam burn can produce a topical scald burn. A flash burn is produced by an explosion. May briefly expose a person to very intense heat. Lighting spark can cause a flash. Management how to manage stop the burning source. Cool the burned area and remove all jewelry. Increased exposure time will increase damage to the patient. All patients should have a dry dressing applied, maintain body temperature, prevent infection, and provide comfort. Let's talk about inhalation burn. Can occur when burning takes place in enclosed spaces without ventilation. Upper airway damage is often associated with the inhalation of superheated gases. Lower area damage is often associated with inhalation of chemical and particular matter. So again, the upper airway damage, when you do it, usually associated with inhalation or superheated gases. The lower airway, you are going to associate with chemical and particular. You may encounter severe upper airway swelling, which requires immediate intervention. Consider requiring ALS backup. The combustion process produces a variety of toxic gases. Carbon monoxide intoxicated should be considered whenever a group of people in the same place or report a headache or nausea. Management first ensure your own safety and the safety of your pre-hospital treatment of patient with suspected hydrogen cyanide poisoning includes decontamination and supportive care. Care for any toxic gas exposure includes recognition, identification, and supportive treatment. Dressing and all bandages. All with required bandaging. Splints can help control bleeding and provide firm support for dressing. There are many different types of dressing and bandaging. Dressing and bandages have three functions: to control the bleed, to protect the wound from further damage, to prevent further contamination and infection. We have sterile dressing. Most wounds will be covered by universal dressing, conventional 4x4 and 4x8 gauze pad, assorted small adhesive type dressing, and soft self-adhere roll dressing. Universal dressing are ideal for covering large openings. Gauze pads are appropriate for smaller wounds. Adhesive type dressing are useful for minor wounds. Inclusive dressing prevent air and liquid from entering or exciting the wound. Thank you for being here. If you have any questions, we should be able to answer them after this 5-minute break. Thank you and have a pleasant day.